Assalamu alaikum. Hello and welcome to another episode of Care Across Cultures. I'm your host, Medban Hussain. You are listening to us on Link FM 96.7. Every week, we talk openly about health, care and cancer awareness. We also look at how culture, faith, family and community shape our experiences. This program is about making conversations easier. It's about breaking down barriers, sharing voices from our communities that don't always get heard. It's about understanding, trust, and where to turn to for support. Today I'm joined by a guest from a local community organisation. They're doing important work in Rotherham and have been for the past 15 years, I believe. We'll be talking about community support, trust and health awareness, and what really helps people feel safe when asking for help. As always, this is your programme too. If you have a question or you want to join the conversation, our studio hotline is 0114 26 1818, or you can text us on WhatsApp on 07939 849 339. Before we start, here's a disclaimer. The views and opinions expressed on this programme belong to my guests and me, and are not necessarily those of the organisations that we represent or of Link FM. This is Care Across Cultures. Irshad Bhai, Assalamu alaikum. How are you today, sir?
Alhamdulillah, as well as can be.
Thank you so much. Thank you so much for joining us today.
My pleasure.
Taking some time out of some pretty serious work that you do over at YAWR Services.
Alhamdulillah. Yes.
Mm-hmm. For listeners who may not know, tell us a little bit about who you are, first of all. Who you are, what do you do? Yeah? And then we'll talk about YAWR Services.
Yeah, so my name is Irshad Akbar. I've been in Sheffield for quite a number of years. I'm sure most people are aware of who I am. I've got links with the masajids, various community groups. But of the past, maybe since 2013, I've been actually helping YAWR Services. Now, YAWR Services is called You Asked, We Responded.
I really
you
like
asked,
that.
And that bit, what it means is that you asked, we respond to your needs.
Okay.
So it's YAWR, not YOUR. Some people get confused.
Yes.
So YAWR is YAWR. So basically, we actually and what we do, what it says on the tin.
Okay.
You ask, we respond.
Yes.
Yeah. And it was set up by a group of ladies back in 2012.
Okay.
To help the community.
Okay. So when you say help the community, we're talking about Rotherham.
Absolutely, that's right.
And
we all moved out now to Sheffield as well. Now.
You're moving to Sheffield as well, which is great.
Right, yeah.
So when you say community, which specific community or in general?
Well, because, again, going back to actually what I said earlier on, this was set up by a group of ladies. Okay. You know, I know involved in setting it up. My role at YAWR Services is just to be the back office.
Right.
The front office is always the ladies.
Right.
I'm just there to support them to make sure that what it says that's actually the infrastructure is in place for them to deliver the services. So a couple of ladies got together and said, actually, the need in our community, especially in the Pakistani community, which in Rotherham, the Pakistani community is getting older.
Yes.
They've been there a long time, and there was nobody actually supporting them.
Okay.
So they actually said, look, we need to do something about this. Because, I mean, they have their parents getting elderly. So they said, we need to look at our parents. I'm sure the other parents as well, that, you know, that help and support. So basically, they set up YAWR Services to try and actually just maybe do a befriending service.
Okay.
To sit down with individuals, help them, talk to them, because as you know now, Miraband, you know, we've got extended families now. You know, sorry, extended families. So it's gone now.
Gone now, yes.
And everybody's, because of work, other things, people are actually moving out. So unfortunately, that leaves the parents at home on their own in some cases. So basically, one of the things that ladies do, they talk to the council, and they go what's called spot purchases. So if they've identified an individual or a family or parents that were actually, you know, vulnerable, so okay then, council say okay then, go and support them.
Okay.
And that's how it's sort of about, you know, identifying and the council then supporting them on that basis. You know, it was very, very minimal funding.
Okay.
But the main thing is, it wasn't the funding they were going for, it was to support the community.
Right.
And that's how we set up in 2012, 2013.
So very small.
Very, very small.
Very small.
They've grown organically.
Right. Okay. But because you are quite sort of large for a community group organisation, I was on your website.
Yeah.
I have done some work with your services from the Rotherham Hospice, but I was on your website, and there's a lot of stuff that you do, isn't it?
Well, I think the main thing is that health and well-being.
Yes.
Now, what is health and well-being? That's the key question. It's not just about looking after someone's health.
No.
There's a lot of other things happening within a person's life. So to me, you know, if you're happy, if you are actually, you know, out there actually, you know, enjoying what you're doing, that's health and well-being. Now, that doesn't stop it being actually somebody who's got maybe ill health, somebody who's actually probably needs to go to doctors, or somebody needs to go to a hospital, whatever. It's not that. It's more about looking at a whole range of things that can help that individual. So, you know, the health is the most important.
Yes.
But also education. Also, we're getting employment. Because all that cost of living affects the health and well-being. Because the worst thing is, and anything of all this, is depression.
Of course.
Depression causes stress. That affects the weak points of your body. And if you're stressed out, no matter what you do, you know, which is the ailments that you have, the actual, you know, increase.
Yes.
So by looking at the whole range of issues, from supporting an individual who actually just maybe at home wants someone to talk to actually getting someone to a job, or actually, you know, looking at their needs, you know, how we can improve their quality of life, which that's the thing. We look at there's a whole spectrum of things that we offer.
Okay. I mean, that sounds really wonderful, because I do agree with you. I think one of the things that I've mentioned on this program with many guests previously is that there are some communities and some members of communities who don't access health support early on. They always end up at crisis point. That's when they seek help. But what you've just said, in terms of there's lots of other things going on, and their health may be the last thing that they're looking at. Yeah. So we're talking about finances,
absolutely,
housing, jobs, family sort of relationships, and all of that kind of stuff that's going on. Yeah. And that's one of the barriers, isn't it, that's been identified.
I think the key thing here is that you don't know what you don't know. That's the main. And the other thing is what's fear the unknown. And when you talk to actually the mainstream organisation, they say, "Oh, you're hard to reach."
Yes.
Well, we're not hard to reach.
Right.
They don't know how to reach us.
Right.
And that's why the community groups like PMC, like, you know, Northern Desby, there's actually, you know, there's actually Friends in Need, there's actually people actually in Sheffield, you know, they are the crux of actually ensuring that the community are engaged. They know how to reach the communities. You know, the key thing is that we are aware of what the community needs are, because we have lived experiences. The mainstream don't have that living experience.
No.
So because they don't have that, they say, "Oh, they're hard to reach. You know, we can't get hold of them." Well, I mean, this is something I've debated many times with the mainstream, you know, Blackpool authorities. You know, it's not hard to reach, but utilise the community groups to actually make sure that we can make pathways where you can actually reach these organisations, support them. That's one thing. Sorry, go on.
No, it's fine. You carry on, please.
So one thing is actually, how do we get to meet them? And that's why it's important. The other thing as well is that the actual public authorities, like the health, the councils, and other organisations, you know, because they're very jargonistic.
Okay.
So what is this? So when somebody sees something, I mean, I'll give you an example. I was telling somebody, you know, a few weeks ago, you know, and it comes down to one of our drop-in centres and say, you know, and said, I've got this envelope here, brown envelope. Don't open it. He says, why not? Some tax. I said, look, open it.
Mm-hmm.
No, it ain't. Because the fear of what's is in buildings, you know, it's tax. What are they going to ask me? So what's it? Our job is to actually trying to address that. So I said to him, open it up. You open it up. I said, okay, let's ring them up. I can't ring them up. So I said, okay then, I'll ring them up, but you need to speak to them so they allow me to talk to them.
Mm-hmm.
So he opened it up, looked at it, said, it's nothing, but I need to ring them up. So I rang them up, and before, as you know yourself, you know, they won't talk to me because I'm not the person. I gave it to the person who actually was there. And before you know it, they talked about like nothing. Breaking down that fear.
It's that initial mistrust
that's
and
right,
fear
yes.
and misunderstanding.
Right, yeah.
It's that fear
of
of the unknown, isn't it?
Absolutely, and I think that person when he left said, I can do this now. So I'm not to do it for them, it's to coach them.
So what you said is wonderful actually, because you're not doing it for people, you're not doing it to people, you're helping them to do it for themselves.
Because we hate it on tomorrow.
Well, no, that's very true. That is true.
And the key thing is that was this thinking themselves, they're more confident.
Yes.
So that's health and well-being.
Yeah.
The confidence releases that stress, that tension. Therefore, the health is improving.
So a bit of hand-holding, what you do.
Mentoring. Absolutely.
Mentoring, hand-holding, breaking some of that sort of mistrust.
Artificial barriers.
Yeah. Removing one barrier at a time.
Absolutely. Small baby steps.
So it's a key thing, isn't it, Irshad? If an organisation like yourself, as in a community group, who has links with the community, if you weren't there, that person potentially may never have opened that.
Well, we've seen it many times, Mirabanda.
Yeah.
People come to us and actually, you know, what's this? They are actually, basically, they don't know where to turn.
They don't know where to turn.
They won't leave the house in some cases.
Okay, let me spin that a little bit. They don't know where to turn. There are lots of mainstream services. Yeah. There's the Citizen Advice Bureau, you know, yeah. Yes. There's lots of sort of, you know, we talked about mental health, depression. Yeah. There's Making Space, there's Mind, there's all of these kinds of organisations, yeah. The one thing that I always mention on this programme is that if it's anything to do with your health, the first point of call is your GP.
Absolutely.
Go to your GP. And I think it's a really important point that anything to do with your health, go to the GP. Because I know that someone listening, or you may have an example of, well, we went to the GP, couldn't get an appointment.
Absolutely.
And that's something which is nationally, you know, there is an issue, we understand. But I also work with GPs who say that, well, you know, come to us, ask for help, you know, and they will do that for you, isn't it? And I think it's a key thing that one of the messages I always give on the programme is, if you have a health issue, go to your GP. If you can't speak English, ask for an interpreter, and one will be provided. Okay. And now many GPs have found that are employing multilingual staff. So there's always someone that you can find. And even some GPs I know speak Urdu, Midpuri, Punjabi, various other languages. So it's a key thing, is that not taking anything away from your services, because I think it's really key that, you know, organisations like yourself, you know, need to exist and do support. But there's always that other thing as well, isn't there?
Absolutely, and one thing is, I would never ever, say, and that's what we will never ever give medical advice.
Well, no, that's
because
not
we can't.
No.
And we always say that if you've got a medical issue,
go
and see a clinician.
Yes.
Go and see a doctor. Because we're not there to say, take this tablet, we don't know, you know. And therefore, we would never ever put in that position. But also, at the same time, when they come to us, say, and you're right, nowadays it's hard to get an appointment. Doctors are available, Yes, and but I know they're very busy, and there's a lot of pressure on them as well.
Yes. Yeah.
But people are waiting, and it's when they come to us like, can you ring doctors for us? Not because they can't do it themselves, because what it is, they've had away on the phone.
Yes.
And therefore, it's a friendly face that they see.
Yes.
So we will always say to them, first and foremost, if you've got a medical issue, doctor is the main thing.
Yeah.
You know, but then then we can then help them. But also the other thing as well, and this is unfortunately what happens with the doctors, you know, which I'm doing a fantastic job. You know, I'm not knocking the doctors.
No.
Because they've got a lot on their plate.
Yes,
you know.
they have.
But also, the medication that tends to be given to actually the patient, it's to suppress them. It's not to address the ailments. And again, that's not for the doctors, because they're giving them something to help them but that is a long term may not be the answer. The answer is the things that they can do to actually improve the quality of life by doing things that they enjoy.
Exactly.
And that's the key thing.
But and that's I do agree with you. But you know, if there's a health issue, one person looks after the GPs look after that, or the hospital, or whoever. But then you and organisations like yours across the country are there to also help support you, patients with other issues that obviously a GP may not be able to support. Okay, that's great. Thank you so much. So, which communities does YAWR Services mainly work with?
It was mainly with the Pakistani Mirpuri community.
Right.
You know, this is one particular. That's why I say most of our staff, all set up initially, you know, off from that community. So basically, they find a need in their community of interest, and therefore they supported that. But that's now evolved now.
Okay.
So it is, and we'll talk about the projects later on that we're doing.
Yeah.
But we work with the new arrivals, asylum seekers, refugees. We work with here from the European communities. We most of our work on the SPS advocacy and befriending is actually with the indigenous communities. So
SPS, you have to explain that.
Okay, SPS is called Social Prescribing Service. So basically, we have a contract with Van Rotherham through actually the NHS. We've got a contract with them to deliver two kinds of contracts on social prescribing. One is called befriending, which is to do with mental health. One is called advocacy. So basically, what's we get SLA, sales value agreements from them, and then we have to actually support communities or individuals that they then sign on tours to go and support. So the doctors refer onto VAR, who then will send on tours saying, can you meet these people? And these people are across the whole community.
Right.
You know, from European, Pakistani, the indigenous communities.
So everybody, open to everybody. Yeah. That's a good thing. That's a good thing. Now, because you mentioned social prescribing, and some of our listeners may not understand what social prescribing is, it's a wonderful thing. Help me understand, what is social prescribing?
Yes, it's a big aspect. I think the main thing is, in a nutshell, which is, like I said, we have two projects or two areas of social prescribing. One is actually called advocacy. One is called befriending. So advocacy is to actually try and work with individuals and find out what their needs are. Okay. The needs in the sense of, you know, have they got issues with a pension? Have they got issues actually with maybe getting a personal a PIP claim, personal dependence payment? Right. Do they want a DLA claim, disability leave allowance? Do they want any other help, mobility?
So benefits.
So benefits. So advocacy is the benefits area.
Okay.
When we sit down with them, identify their needs. Because if they don't know, they don't know what to go.
They don't, exactly.
So our job is to sit down with them and help them to complete them forms, and maybe coach them so they can do themselves in the future. Yeah. But initially, our job is to handhold, and sometimes trust is very important.
Of course.
We have to build that trust with them first. Once they trust us, then they will tell us everything they want to give us. So it's very important to actually try and address. So advocacy is actually is to help them to improve the quality of life by making sure that they're aware of all the benefits that are available. That could be actually help with windows. Yeah. Help with actually maybe actually help with the utility bills. Yeah. A whole range of issues. Right. So that's one. Also, it's all about things that probably actually looking at mobility, you know, with benefits for, you know, but yeah, it's benefits mainly. That's right. Now, the befriending, this is where people have got a health and well-being issue. You know, mental health.
Yes.
You know, which is, and to all our communities, that which is, unfortunately, we say, you've got illiteracy.
Yes.
You've got illiteracy. You know, and it's true. It's true.
Yes.
That's our iman.
Yes.
But sometimes Allah also says, you know, you also on your backside, go and do something about it.
And do something. Yes. Yeah.
And this is where we come in with the befriending. We sit down with them. We go and meet them. We take out for walks. You know, we address various issues. There's actually, you know, that's actually hopefully they can actually, you know, get out and get supported. So it's more hand holding and help them to actually, you know, sometimes, you know, they may have actually got put in the house.
Yes.
Because they don't find their way, or they don't know where to go to. They'll not be at the house for ages. So that we go. That's where the befriending comes in. Where we sit down with them, talk to them, take them for walks, take them shopping. You know, take them these places. So that's, you know, and again, that again is what they are referred to as from the actual from VAR. We actually get from the GPs, etc.
So the befriending bit is about sounds to me like a hand holding again, but actually supporting them in a way that I'm here with you.
Yes.
Yeah?
Yeah.
And helping them to understand. Because that sometimes you mentioned right at the beginning of the program about the family dynamics, the extended families, which has all sort of disappeared in many sort of communities, hasn't it? So that it may be that not just elderly parents are left on their own and they don't know where to turn to, but sometimes there's also that thing about me individually as a person. I've never asked for any help from anybody, and I could do all of this before, and now I don't want to ask anybody because I don't know for whatever reason. So you would support someone like that as well.
Absolutely. That's the trust element.
Yeah.
But sometimes what it is, and again with the elderly, it's not just elderly. They're all single parents with support.
Yes.
You know, there are people actually who probably, you know, where it is, you know, are so disillusioned with what's happening around them that they say, look, I've switched on for everything. Yeah. So our job is to go in there and build that trust up with them again, build the confidence up again, so therefore they can then actually they can improve the quality of life by actually engaging activities that we put on for them, or we know where they are, and we actually signpost them to these activities.
So ultimately what you're doing is you're trying to get them to do it for themselves and building that confidence.
We're not have down to hours with every individual. We're not with them 24/7.
No.
We're not with them for 12 months. We are given so many hours from VAR to work with that individual. So our job is to actually not for them to rely upon us, or your service will come and support us. No. It's to get them to actually, you know, to a stage where they can say, "Oh, I'm okay now." But the main thing is that even when they're okay and we've actually signed them off, they'll still ring us up and say, "Can you just help us?" And we'll say, "Of course we can." Yeah. You know, we will never send anybody away. We don't have a no wrong door policy. Sorry, we have a no wrong door policy.
Right.
That means that if somebody comes along, no matter what we want, we will help them.
Thank you so much for that. If you've just tuned in, you are listening to Care Across Cultures with me, your host, Mirban Hussain. You're listening to us on Link FM 96.7. I've been talking to the wonderful Irshad Akbar from YAWR Services. And that's not yours as in mine and yours. It's YAWR, which means you asked and we responded. It's a wonderful name, actually. We're just going into a short break. And we'll be back shortly. Allah Hafiz. Welcome back to Care Across Cultures with me, your host, Mirban Hussain. Welcome back, and I've been talking to the wonderful Irshad Akbar, who I should have known many, many years ago. We've been working for the past 30 odd years in the same kind of environment, but we only met about a year ago, which is, I don't know what happened, but that's how we met.
I did some work in Wakefield with Rashid. You know, I don't remember. So we have come across it.
Yeah. And we've been talking about YAWR Services. So, Irshad, welcome back.
Thank you.
And I still can't understand, in all those years that we worked in very similar sort of environment, why we never met. Either your memory has gone or mine's gone, because I'm sure we met at some point, but we've both changed a bit, haven't we?
Not half.
Right, so let's carry on the conversation. Care Across Cultures is about raising awareness around health issues. I talk a lot about cancer. I talk a lot about life-limiting conditions. I talk a lot about health inequalities, health inclusion groups. So when it comes to health, illness or cancer awareness, what makes things harder for people from minority groups? What do you think? Your experience.
Right. First up, taboo.
Taboo.
Because we don't want to tell anybody we're ill.
Okay.
I mean, I've been through that myself.
Right.
But, I mean, to me, it doesn't matter. But I'm, as you can know, I'm very vocal. But there are people that I'm aware of who say, I don't want to tell somebody, but they say, they'll say, I've done something wrong. What she then say, others put this as I want us.
Okay.
And unfortunately, that's what happens out in the community, because someone's done black magic on me.
Okay.
So cultural and religious, unfortunately, creeps in.
Okay.
Yes, we're all going to be ill, but it's how we handle that illness is more important. And the way we handle it effectively is not to keep it within us, but to share that with people. Sometimes you can't share it with your in the family, because you don't want to upset them.
Mm-hmm.
That's why you have to share it with people that's actually who probably, who you can trust.
Yeah, friends maybe.
But, again, sometimes where it is, even with friends, you say they're going to tell somebody.
Right.
So maybe you build that trust with somebody, and you work with them for or you actually meet them for a few times, and then you may divulge something to them and see how they react. And that's the key thing about what your service does, is that we don't actually we don't make judgments.
Mm-hmm.
We don't actually look at this person and say what's this, so and so. We actually look at the individual and say, okay, we discuss it, but everything you say is confidential. That is built into our training for our staff.
I want to talk just a little bit about confidentiality, because the trust bit comes with the confidentiality bit, doesn't it?
Absolutely.
As professionals, all organisations, we are bound by confidentiality, unless with some stipulations. What I've also found over the years working with many different community groups is that it's very difficult for them to get to trust a professional because of confidentiality and their understanding of what it means and what it means to a professional. Because if you break confidentiality as a professional, there are some serious consequences.
Absolutely.
And I think, is that something in your experience you found that the communities that you help, or some of the people that you've supported, that they don't seem to grasp that?
Right. The main thing is that what it is, Rotherham, look at Rotherham. It's a very close-knit community.
Yes.
Everybody knows everybody.
Yes, we do.
What's who you want to see, somebody knows somebody,
Yes.
So that's the reason why people will not express their thoughts and feelings.
Okay.
Or if I tell them they're banned, like, you might go to Irshad.
Yes.
So therefore, we have to build that trust with the individual. And the key thing is the training that we give to our staff. We make sure that they actually, wherever people say to them, does not go anywhere else, And if fortunately, touch wood, we've not had that experience yet, But, it's very important to get the trust of that individual, then we can help them in more with someone.
Yeah.
But once you make that trust with one person, then it's like wildfire. It's actually, everyone will say, oh, don't trust them,
Yes.
And that's the key thing. So, what is someone saying to us, we actually we might have to discuss it with the managers or something. That's what it is, just to actually get their opinion.
But that's within that professional.
That's right, yeah. But it's not actually out in the wider community.
Yeah. You're not going to talk to their neighbours. This is something that I think communities need to understand, don't they?
Because what it is, like I said before, what it is that unfortunately with the barriers that our community face, it's not just about actually health and well-being. It's about cultural and religious.
Okay.
Because face to face, when it happens to them, they'll say, you know, it could be said, you know, it was black magic on somebody.
Okay.
Or it might say that, you know, it's come from Allah, you know,
Yes.
Of course everything's from Allah.
Yes.
That's our iman.
Yes.
But ultimately, it's something to we have to do something about it, to address it.
Yeah.
And also, got to remove that fear of black magic is there. Even the Prophet ﷺ had black magic put on him. So we know that's there. No, that's part of our iman. We know it's there. But the main thing is we can address that. And by addressing that is actually where we can actually, and everything's in the Quran. There's nothing that where it says that, you know, we go to all these different organizations, all these different people, but ultimately it's in the Quran. And once you get peace and solace from reading the Quran and reading Salat and actually, you know, being a spirituality then helps to actually address some of the issues that we're facing.
Yes. Because there are, I mean, you know, yes, the religious bit about you reading the Quran and that gives you peace as a Muslim and solace as a Muslim, but there are also the Quran always says that, you know, for every illness I've also sent a cure.
Absolutely.
And does that not say that, does that not mean then, okay, you have this illness, you have this disease, there's a cure, and go and search for a cure as well?
Absolutely. And also, the Quran also says, to this meaning, please forgive me, but I'm not a scholar, you know, it also says that Allah does not give a hardship to somebody who cannot bear it.
Yeah.
No. So there's a lot of things in the Quran, but obviously we won't just take part of it and say, oh, that's that, you know. So we have to read it fully. But the key thing is, you're rightly saying that what it says that, you know, is that for every illness there's a cure. Go and search for that cure. That cure does not mean medication.
Not necessarily, no.
Yeah.
Are we talking multidisciplinary teams, aren't we? We're talking about, okay, so a health issue, go and see your GP. Yeah?
If it's a,
yes. Okay, go and see your GP. Okay, and they will give you some medication. If you need something else and it's mental health or something else, you know, they may refer you to a psychotherapist or a psychologist or, you know, counsellor. Yeah? But if you have a faith, whatever that faith is, you need to then go and see your spiritual counsellor as well, because it's a mixture of all of those things, isn't it?
And that's the key thing there, which is just is that what is the key thing is that, yes, you might go and see a counsellor. The counsellors are probably, we haven't got enough counsellors trained within our community to be Islamic counsellors.
Yes.
And that's something we need to develop. Yeah. Because at the moment, when the GP sends you a counsellor, somebody who actually doesn't understand your faith, somebody who doesn't understand your background, somebody who actually will do a general synopsis of you and give you general discussions. We need to actually train up our community to become counsellors, where for them understand the faith, the community, the background of the person, and therefore they can actually work with them more effectively, and it's going to make it easier for that individual then. And that's something I think, you know, we should try and promote if we can. Yeah. How can we get more Islamic counsellors on board that people can trust and utilise? Because,
I mean, we have the mosques, masjids, we have imams who know a lot of the Quran. But the key thing is that they are not trained counsellors.
Absolutely.
They can support you with religious prayers and all those kinds of things, but in terms of, they won't have had that sort of training, would they?
And there's two things there as well, Rahman. You know, we actually, you know, and our faith says that men and women different must not mix. You know, so a woman, you know, unfortunately, cannot go and see. They do, and I'm not knocking it. You know, because even if that's spirituality, they do. You know, but they can't go and explain things openly and freely to the male imam than to a female or ustada who's actually understands things.
Who understands it?
So that's why I say we need to actually make sure that, you know, the men can go in and say anything at all they want to the imam, and they can be very frank with them and open and frank. You know,
but it's going to be difficult for a woman.
That's why we need to actually get more. And I know in terms of walk, you know, from what I've heard, you know, there's a fantastic imam there, and also his wife, I believe she also there, and she actually supports the women there as well. So I've heard. I don't know, you know.
I don't. Yeah. But I think that is changing because we're getting female imams and chaplains across the country, aren't we?
And I think that's why we need to actually try and encourage that more and get some of our, you know, well-educated ladies into these areas, so therefore they can actually then support the community more effectively.
Yes.
And that's something that I would love to actually see happen and develop, you know, as we move forward.
Here's something that I came across, and I was quite surprised working at Rotherham Hospice. There are a lot of misconceptions about hospices. When I said to someone, I work at Rotherham Hospice, and they said, oh, that's where people go to die. Yeah? And that really sort of surprised me. Because some people do die in a hospice, but that's not where they go to die. There's a big difference. And hospices over the years have changed so much. It's more about living well with an illness, with a cancer that may be incurable, untreatable, but it's also about giving people a better quality of life. So that's what hospices are. Okay. Now, end of life conversations. And this is something that surprised me even more. I had conversations with professionals and with community members, Muslims, who, we don't do ACP, which is Advanced Care Planning. And that again struck me, because I thought that, you know, as a Muslim, the first thing that we plan for from birth is death. So there's this sort of, you know, some things are missing, isn't there? What do you think is happening there?
Two things there. First of all, what you do is what you're doing brilliant for the community. You know, by going out there and telling them what hospice does, and that's something that, you know. I mean, I myself have used hospice myself. You know, I thought hospices were where you go and actually that's it.
End of life.
But what's this? When I became ill, I went to the hospice, and I still go there now and again. You know, to actually, you know, because what it is actually, you know, you can relate yourself to other people, and also you can then, you know, actually realise that actually I am very fortunate. Yes. You know, and that again, that helps you to improve your health and well-being. So what you're doing is fantastic. You know, that's brilliant. You know, now with regards actually, you know, we said about, you know, what it is about end of life and care. We need to. One thing we don't do. We say we plan for death. We don't. We prepare for death. We don't plan for death.
That's a big difference.
And this is where we're trying to educate our community as well. That ultimately, you know, what it is, prepare yourself. You know, in the sense that what it is, and preparing is not about actually saying, you know, saying I'm going to die, or whatever. You know, what it is, preparing is saying having a will. Yes. Is important. And in the Quran, to this meaning, it says, you know, what is how we're prepared because you don't know what's going to happen tomorrow, or the next hour you don't know what's going to happen. That's one thing. Second thing is that what is you come across power of attorneys. That is a key thing, because if I mean, and I'll give you my example. You know, what is, you know, like experience. You know, when I was ill, I've set up power of attorneys for my kids. You know, straight away. You know, because if at the moment I'm okay, I can actually reason. You know, I've got a ability. You know, but if I lost that ability, the power of attorneys then will actually allow my children or my wife to actually then make decisions on my behalf. Yes. Now, if you don't have power of attorneys, then basically the NHS, the banks, whatever finance, they can come in and do what they want to do, and that is something that we need to make sure our community are aware of, how to plan for when you are ill. That's one thing. Second thing is that what it is, you know, I said make out rules, but also it's about saying that, you know, planning in the sense that what it is saying, you know, there's a number of things, you know, and again I don't want to talk about the inheritance tax is the main thing, you know, it's just plan for that. But out there, people have got, fortunately, alhamdulillah, you know, people have very well off, they've got houses, whatever, you know, but what it is, if you don't plan for that, the kids won't get a penny of it. Because what it is,
if we're going to probate, and that's a long thing.
And the other thing as well, we've seen it in ourselves, in our communities, where people actually are fighting over nothing. We see it in Pakistan, they fight over land. Here now they fight over, you know, a house or a room. You know, and I think so. We have to plan. So therefore, which is that when we do lead this life, you know, that actually we've got things. We prepare things that the children then, you know, can continue as they are now instead of falling out. You know?
So I think from what you've said, and you know, from what I've sort of understood, is that there's a different understanding of what advanced care planning means to some communities, especially, you know, some of our sort of, you know, Pakistani Muslim, they seem to think that it's about planning for death. And it's not planning for death, it's making sure that your accounts and everything is in order.
Absolutely.
In case something happens. And I think the key thing that, you know, I always talk about when I do talk about advanced care planning is that finances is something that, you know, can always be dealt with at some point.
Absolutely.
Yeah.
Absolutely.
But health,
True.
if you fall ill tomorrow and you are at death's door, for example. Yeah?
Yeah.
And if you are not able to make a decision because you haven't got capacity and you don't have a power of attorney, your family doesn't have that. And what I think many communities and many people do not understand, the general public don't understand, is that someone else will make a decision apart from your family. And that's what they don't understand. Yeah, please.
We ask it reach.
Yes.
I've got a house, you've got a house, we've got houses, you know. And sometimes you're living, me and the wife living in the house on their own, or just me, if somebody's passed away, that's fine, you know. Now, what's happened is that if you fall ill, the council can come in and say, okay, you fell ill, we're going to put you in a home, we're going to sell your house and pay for your, you know, treatment.
Yes.
And that's if you haven't got a power of attorney.
Yes.
Now, if you've got a power of attorney, and you've got somebody that you can look at, that's why it's crucial that while you have a mind, create that. It's not going to affect actually, you know, it's not going to give power to your children.
Yeah.
It's going to give them power to your relatives when you can't think for yourself.
Yes.
And that's why it's important to have that in place even now. You know, end of the day, we don't know when we're going to pass away.
You don't need to be ill.
No.
You don't need to have a condition.
Right, Yep.
So what you're advocating, excuse me, what you're advocating is that people should definitely look into a power of attorney, will, as a general thing.
Yep.
Don't wait until you're unwell. Don't wait until you're 70 odd. Even if you're 18 or 20, you know, look into that, because as Muslims and as we know that anything can happen to us tomorrow.
Absolutely.
Yeah.
My nephew passed away at 2023.
There we go.
You know, I mean, alhamdulillah, and the family's broken.
Yeah.
You know, but what it is, so, you know, and there's other incidents that we've seen our own eyes. We've got experience where people actually who are young have passed away, you know. People actually, you know, or maybe actually in the 40s and 50s have passed away, you know, while they're sleeping, you know.
Yes.
We've seen it, you know. Yeah, we need to act upon it rather than just actually say, you're just actually your source. Say, what can we do?
What can we do?
That's
Some
right,
practical things. Thank you so much for that. I want to change slightly now, because we've talked a lot about some of the issues, some of the challenges, you know, some of the misperceptions of around a lot of issues. I want to talk now a little bit about health services, public services, because we talked about YAWR Services and various organisations like yourselves as being that sort of bridge, you know, that trust. What do you think that, you know, some of the mainstream services, health services, public services, charities even, what do they need to do differently to reach communities that they don't already reach? And like you, I don't like the hard to reach.
That's right. That's
understanding.
Right. Yeah. Well, with the mainstream services, unfortunately, they've got no money.
No money.
So what's the matter? What they do, they're always going to struggle.
Okay.
This is why it's important that charities and community organisations are the key conduits for them to actually reach the people that they need to reach. Now, one thing we should do is network.
Okay.
We're very poor at networking. We put our working together. The charities, you know, you've got similar charities. It's like the masajids, unfortunately.
Yes.
You've got masajids actually in one corner, and then under the street you've got another masajid.
Yeah.
You know, we need to actually do something similar. And even with the community organisation, what we need to do is actually say, okay, let's get together and let's develop what's called a hub and spot model. Now that means that the hub is actually where they all come together, but then it's discussed what's needed. Then they go out and deliver into their own communities.
Okay.
And that is something that I think if we can create that, it will make our life a lot easier. It will ensure that we reach the community far more effectively, and also we can maximise the scarce resources that are available to us. Because unfortunately, I don't like to use this word divide and rule, but unfortunately, the local authorities, they know how we operate, so they pick us off.
Okay, so let's not go there because what
that's my opinion.
Thank you. This is a general awareness raising program. It is not political in any way, shape, or form, and no one from the councils are here to rebut what you said. Absolutely. So we're not going to go there. Okay. So what you're talking about is a new sort of a partnership. A networking partnership. Absolutely. But there've been many partnerships, an agreement that we will do X, Y, and Z, and I see a lot of benefits in agreements, partnership agreements, especially for two reasons. One is the reach, and secondly is that each organisation will have their own strengths and weaknesses, and if you get together, you are then going to sort of minimise your weaknesses and maximise your strengths. Absolutely. It may be that you're fantastic at advocacy, I'm great at something else, and we can sort of cross seed each other and help each other, can't we? So we are coming close to the end of the programme. If you've just joined us, you are listening to Care Across Cultures with me, your host, Mirban Hussain. I've been talking to Irshad Akbar from YAWR Services in Rotherham, which is a community organisation which has been around for about 15 years, and they support all members of the community with various programmes. And so what I'm just one last thing from you is that what are your hopes or priorities for your services over the next few years? Because I know that there's a dementia awareness project that you've looking into delivering very soon, aren't you?
That's right. I think the key thing is that we want to actually. The hope is that we can work more closely with the wider community, the wider organisations. Okay. The community organisations, so we can maximise what's on the ground. We've all got, like you said, we've all got strengths and weaknesses. The main thing is understanding your weaknesses and then knowing who else can improve that by working with them. That's the key thing. And my hope is that we can actually develop trust amongst actually not only Rotherham, Sheffield as well, South Yorkshire wide. They'll trust South Yorkshire wide. Say, okay, how can we support each other? Because at the end of the day, South Yorkshire is only 25-mile radius.
Yes.
So if we can work together, we can then put things in place. Because there are good things happening in Doncaster, which I'm aware of. Good things happening in Sheffield, in Barnsley, and Rotherham. But the point is, they work in isolation. They work together. We can maximise what's out there. That's my hope. Secondly, is that with the projects that we've got on board, is about sharing the experiences that we've got. The more we share, more we actually talk to people, the more people become aware of what they're doing, what we're doing, and hopefully reaching the people that need it. They might have people actually who don't know about YAWR Services.
Yes.
But they can then say, okay, go and talk to them. And again, it's not saying that we want to take over their students. It's about how we can improve them by working together. So that is another hope. So I think I think the future is bright if we work together. And we've got to actually break down those values and build trust amongst ourselves. That's the main thing.
Thank you so much. You've been listening to Irshad Akbar from YAWR Services. On that note, we've come to the end of the programme. I'm Mirban Hussain.